This study is about extranodal NK cell lymphoma, a rare subtype of Epstein-Barr virus-related non-Hodgkin lymphoma. It has distinct geographic and ethnic predilection, being more frequent in some Latin American countries, such as Mexico, Guatemala, and Peru. Our study showed clinical features, therapeutic approach, and outcomes of NK cell lymphoma in some Latin American countries in order to fill the knowledge gaps regarding extranodal NK cell lymphoma in this region. It's a retrospective multinational analysis including newly diagnosed NK cell lymphoma from Guatemala, Mexico, Brazil, Peru, and Bolivia from 2000 to 2023. We collect baseline demographics, clinical and biological characteristics, treatment patterns, and outcomes. Our primary endpoint was overall survival. A total of 303 patients were included with a median age of 44 years, male predominance, with a nasal ulcerative lesion and B symptoms were present in 50% of the patients. Early stage was more frequent. 88% of the patients receive a first line of treatment, including concurrent chemotherapy and radiotherapy in 68%, only chemotherapy in 26%, and radiotherapy in 6%. The systemic chemotherapy based regimens include anthracyclines in 28%, platinum-based regimen in 13%, and asparaginase-based regimen in 36%. Complete response rates, according to the chemotherapy, was 39 for anthracycline-based regimen, 67 for platinum-based regimen, and 49% for asparaginase-based regimen. No differences in results and treatments regimens in patients in early stage. However, the patient with advanced stage had better results with platinum-based regimens with or without asparaginase versus anthracycline-based regimen. The median follow-up was reached to 12 months. The overall survival was 59%. The worst overall survival was seen in patients in advanced stage, indistinctive of the treatment regimen. When we analyze the overall survival between the different types of chemotherapy, we observed that the patient treated with asparaginase regimens had better overall survival, 38%, 38 months, and the patient with advanced stage had 6 months of overall survival, and the patient with early stage had 28 months in the complete cohort. the leading cause of death was progression, infection, and lack of access to chemotherapy. Okay. This study represents one of the largest analyses of ENKTL lymphoma in Latin America, providing valuable insights into the clinical treatment patterns and outcomes. Our findings highlight the poor prognosis of advanced stage, so underscoring the need to early detection and timely intervention. This study also reveals the lack of access to new drugs because only 36% of the patients had access to asparaginase. Some of the challenges involved to access to early detection and timely intervention, access to clinical trials, access to new drugs, and get training lymphoma for hematologists. But there are some research groups in Latin America who help to other countries into the Latin America, such as the Latin American Group of Lymphoproliferative Disorders, GELL. They are focusing in research and they are collecting your own data. They are looking for dismissive the gaps in the access to the knowledge and the diagnosis in the region. They are doing advocacy to make visible to Latin American cancer centers to participate in clinical trials about rare lymphomas that have high incidence in this region.